Drugs used in heart failure are ACE inhibitors, beta blockers, diuretics, aldosterone antagonists, digoxin, hydralazine, nitrates, inotropes, and calcium channel blockers. Drugs used first in the systolic heart failure. Cornerstone for the treatment in systolic heart failure are ACE inhibitors and beta blockers. First to be used in systolic heart failure is ACE inhibitors. When do you use ACE inhibitor and when do you add beta blockers? Treatment of systolic heart failure depends upon the percentage of ejection fraction. Cornerstone of the treatment in systolic heart failure is ACE inhibitors and beta blockers. If the ejection fraction is more than 40, then ACE inhibitors are used. But if the patient is intolerant to ACE inhibitors, angiotensin receptor blockers can replace ACE inhibitors. What ACE inhibitors do? They increase the cardiac output. How? They cause vasodilatation and decrease the afterload. What other functions they do? They decrease the pulmonary capillary wedge pressure. They increase the exercise tolerance and they decrease the mortality. So the choice of drug is ACE inhibitor. First drug until the ejection fraction is reduced up to 40%. What are the contraindications to the ACE inhibitors? If there is angioedema. If there is angioedema, then what drug you used? Angiotensin receptor blockers. The other contraindications are bilateral renal artery stenosis, pregnancy, hyperkalemia more than 5 millimoles, serum creatinine more than 3 milligrams per deciliter, and also it is contraindicated in heart failure with hypotension. Patients are intolerant to both ACE inhibitors and receptor blockers. Then what drug you used? Hydralazine with oral nitrate. If the ejection factor is less than 40%, then beta blockers are added to ACE inhibitors. Contraindications to beta blockers are bronchospasm, bradycardia, and heart block. If ejection fraction is less than 35%, aldosterone antagonist, spironolactone, eplerenone, triamterene, and aminoride are added. What the aldosterone antagonists do? They decrease the mortality, decrease sudden death, and decrease pump failure. What is the caution to be taken with the use of aldosterone antagonists? So they should be used with caution with ACE inhibitor or with angiotensin receptor blockers. Why? Because all of them, they cause hyperkalemia. Diuretics are used in systolic heart failure if there is fluid retention. Two diuretics used in systolic heart failure are furosemide and metolazone. What's the advantage of furosemide over the thiazides? Furosemide that act on the thick ascending limb of the loop are more potent than thiazides and they work even if the GFR is less than 25 milliliter per minute. That is, they can be given in chronic renal failure. And number 3, they reduce the pulmonary capillary wedge pressure before the diuresis. So they act very quickly on the pulmonary circuit. Why in congestive cardiac failure diuretics are used with ACE? Because in congestive cardiac failure, renin-angiotensin-aldosterone system is activated. There is increased sodium reabsorption, increased blood volume, and increased load on the heart. So diuretics are used to remove the increased fluid from the body. And when do you use digoxin in systolic heart failure? When there is atrial fibrillation. Digoxin is positive inotropic and negative chronotropic. It increases the stroke volume, increases cardiac output, increases ejection fraction, and causes diuresis. It decreases the heart size, decreases heart rate, decreases oxygen demand. It is especially useful in systolic heart failure. Improves the quality of life but does not increase the survival. This is important because ACE inhibitors, beta blockers, and aldosterone antagonists increase the survival. But digoxin does not increase the survival, but it improves the quality of life. How does digoxin increases the force of contraction? Digoxin inhibits the sodium potassium pump. So it increases the intracellular sodium that increases the intracellular calcium. Increased calcium causes increase in force of contraction. And how does it causes decrease in heart rate? increases the refractory period at AV node so that it decreases the heart rate. So when digoxin is not indicated, it is not useful in hypertrophic cardiomyopathy, restrictive cardiomyopathy, dilated heart failure, pericardial diseases, myocarditis, restrictive pericarditis, cardiac tamponade, and mitral stenosis. What are the contraindications for digoxin? They are hypertrophic cardiomyopathy, dilated heart failure, and AV block. Why there is a digoxin toxicity in renal failure? Digoxin for excretion is secreted by the renal tubule. So when there is a decrease in GFR, that decreases the digoxin elimination and increases the digoxin toxicity. What is the most common cause of digoxin toxicity? Is hypokalemia due to diuretic use in heart failure. So what type of heart block the digoxin cause? Digoxin causes all types of heart block. But what is the characteristic heart block by digoxin? It causes non-paroxysmal tachycardia, atrial tachycardia with AV block. What is the treatment of digoxin-induced arrhythmia and AV block? Atropine 0.6 mg IV or a temporary pacemaker. Next drug used in systolic heart failure is Nitroprusside. It is given IV and only in sick hospitalized patient. It is metabolized to thiocyanate. What is nasiritide? Nasiritide is also used in systolic heart failure. It is derived from the natriuretic peptide and is used only in refractory cases of heart failure. It is a vasodilator and decreases the pulmonary wedge pressure. The inotropes. What are the inotropes? Dopamine, Dobutamine, amrinone, and milrinone. What is the contraindication to the inotrope? They are contraindicated in hypertrophic cardiomyopathy and they are used in heart failure with low blood pressure. What is the effects of dopamine and what is the difference between dopamine and dobutamine? Dopamine is a sympathomimetic, but in low doses up to 10 microgram per kg dilates the renal and mesenteric blood vessels. So it increases the renal blood flow in hypotension and causes the diuresis. Whereas dobutamine increases the cardiac output without vasoconstriction and increases heart rate. Dopamine causes vasodilation in renal blood vessels, so it is used in heart failure with hypotension, but dobutamine does not cause vasodilatation, so it's only used in heart failure. What are milrinone and amrinone? These two drugs are inotropes, but they are non-sympathetic, non-catecholamine, non-glycosidic, but they are positive inotropic and vasodilator, so they are used in systolic heart failure. The drugs used in diastolic heart failure are calcium channel blockers and beta blockers. Examples of calcium channel blockers are verapamil and diltiazem. Calcium channel blockers are contraindicated in systolic heart failure because they reduce inotropy and stroke volume, but they improve the ventricular relaxation and reduce heart rate, which permits more time for filling. They promote regression of cardiac hypertrophy, reduce arterial pressure, and improve coronary flow. What are the advantages of calcium channel blockers over the beta blockers? Beta blockers can't be used in asthma, COPD, sick sinus syndrome, conduction defects, Prince-Metal angina, and peripheral vascular disorders. Beta blocker advantages are they promote regression of hypertrophy, reduce the blood pressure, reduce heart rate, and they reduce inotropy. So what are the drugs that are contraindicated in diastolic heart failure? Inotropes and digitalis are contraindicated in diastolic heart failure.